Wi-Fi in surgery? No, not the internet. But if you are managing a patient with chronic limb ischemia, this Wi-Fi might actually decide whether the patient keeps his limb or not. The earlier classification systems like Rutherford's and Fontaine always told us about the patient's symptoms. However, they didn't tell us about three critical points. One is how bad is the wound, second is how severe is the infection, and third, how dangerous is the ischemia. All these three are major determinants of amputation risk. So the Society of Vascular Surgeons came up with another classification known as WIfI Classification, where W stands for wound, I stands for ischemia, and FI stands for foot infection. And these factors are determinants of risk of losing limb as well as potential for revascularization. So be prepared to take a few screenshots. Starting with the wound grade. The wound grade is divided into grade 0, 1, 2 and 3, where 0 is no wound, grade 1 is small shallow ulcer, no gangrene, grade 2 deeper ulcer with exposed tendon or joint or limited gangrene, and grade 3 extensive ulcer or extensive gangrene, that is forefoot or heel. Next we come to ischemia, and ischemia is further divided into grade 0, 1, 2, 3 depending on the ankle brachial index, ankle pressure index and toe pressure index. So if the ABI is more than 0.8 with ankle pressure more than 100 millimeters of mercury and toe pressure more than 60 millimeters of mercury, it is grade 0. Grade 1 is ankle brachial index between 0.6 to 0.79, ankle pressure 70 to 99 millimeters of mercury, toe pressure 40 to 59 millimeters of mercury. Grade 2, 0.4 to 0.59 ankle brachial index, ankle pressure of 50 to 70 millimeters of mercury, toe pressure of 30 to 39 millimeters of mercury. And grade 3, ankle brachial index less than 0.4 with ankle pressure less than 50 millimeters of mercury and toe pressure less than 30 millimeters of mercury. Next we come to the foot infection, and foot infection is again divided into 3 grades, that is grade 0 no infection, grade 1 mild infection, grade 2 moderate infection with deeper tissue involvement, and grade 3 severe infection with systemic signs and sepsis. So putting all these tables together, we get the WIfI classification system, which can be grouped as follows. Stage 1, where the risk of amputation is very low and the limb salvage is likely without any intervention. Stage 2, risk of amputation is low with selective intervention. Stage 3, the risk of amputation is moderate and revascularization is beneficial. And stage 4, where risk of amputation is high and urgent revascularization is required. So if the right lower limb is described as W2, L3, FL1, it means that the patient is having a deep ulcer with severe ischemia and mild infection. So next time someone says WIfI in surgery, remember that this WIfI does not connect to the internet, but it decides whether the limb stays or goes. For more such newer concepts in surgery, follow the Surgical Mind.